I think telemedicine for us and some AI derivatives to what we provide today is where we're headed with Futura.
Thank you for joining this episode of the Elephant in Your Hospital podcast with Futura Healthcare. I'm Jason Ashworth, Director of Healthcare Technology at Futura, and your host again. And today I'm joined by industry healthcare leaders Tom Pacek and Ken Levitan, along with Futura's CEO, David Gulian. Today, we discuss emerging technologies, what should be your radar. So with that, when we say emerging technologies, Tom Pacek, we know there are a ton, and there are rabbit holes with each and every one of them. But as I alluded to prior, which ones should be on your radar?
That's Jason. That is a loaded question. There is just so
Indeed
much out there right now. And just coming back from Vive and HIMSS, I saw a ton of it out there. Anything from improving the patient experience to improving billing processing, revenue generation, quality and safety. I mean, it touches all the areas of the organization. There isn't anywhere in the healthcare provider space that isn't being touched, and I'm sure in the payer space as well, that isn't being touched. And there's not technologies out there that are emerging to improve all of those things in the organizations. I would say that, one that's really starting to come to the forefront is the voice recognition has just gotten so good. It's been there for quite a few years now. We've adopted it in our health systems, my past health systems. We've had voice recognition. Physicians got used to doing that. We eliminated pretty much all the transcriptionists in the organization using voice recognition. But now it's to go into even a further step where you're bringing in ambient conversations now. So it's recognizing the difference between a patient speaking and a physician speaking, being able to go through that data and actually bring forth do documentation for you ahead of time. Doesn't mean the physician's not doing documentation still afterwards or review of the documentation, but they're now being presented with what they've said during a patient interaction and then just editing it. So they, I don't want to say they become transcriptionists, but they become editors of their own work, which is really what voice recognition is too. But now it's adding the patient component as well. Nurses are also able to use the same type of technology. So that's one that I thought I saw at HIMSS that was really starting to emerge and people were getting pretty excited about. Ken.
And Tom, I got to tell you that from a hospital administrator perspective, it is one of those things where, we've been talking about this for a long time with natural language processing and being able to pick this up, and this all relates to AI in some way or not other. But that capturing of that set of conversations that then allows for more accurate documentation of the interaction between the caregiver and the patient, and then documentation of all of the appropriate codes and comorbidities that the patient might have, then allows for the organization to get reimbursed appropriately for the care that they've given to those patients. And in some ways, I see it as changing the conversations that I've had with physicians over the years, which is, why are you making me be the transcriptionist? Why am I clicking all these boxes? And if I can do this in a much more, a much easier way than you've asked me to do it before, because we're one of the few industries in the world that have asked our most expensive, most highly trained people to be the ones at the end of that keyboard capturing all that information. And this just, I'm not sure we're there yet, but this emerging technology is one of those that's just very exciting to me, and hopefully we'll meet some of that promise of digitization in a right way that is beneficial both to the organization, but also to the physicians and others to bring back some of that joy in medicine.
I want to get into
there's
some
two
of the
pieces
specifics.
to that.
Oh,
Yeah, Jason, before you say that, there's two pieces to that. So there's the ambient piece that I talked about, which is truly voice recognition of multiple people in the room and getting that documentation right and putting it in the right place. There's another component on top of that, which is really maybe more the CDI type component, the clinical documentation improvement process. And that's really recognizing that text that's being spoken and putting it into proper diagnosis, identification, placing orders, all those types of things. But really, to your point, Ken, getting the documentation right so that the bill drops appropriately without a lot of back and forth between HIM departments, hospital information management, medical records departments, and the physicians asking for more information or clarification, which delays both length of stay, delays documentation, delays dropping the bills and getting clean bills out the door. So there's a huge piece of automation that's coming that's really going to speed up that whole process, both for the physicians, for the hospitals, for patients will not see it directly, but they will be beneficiaries of that by reduced lengths of stays and things like that, because we're turning around processes so much more effectively, efficiently, timely. I'll leave it at that.
So you're almost going into, if I'm reading you correctly, Tom, into the RPA conversation. Is that where you're leaning?
Because it's kind of that's not specific to RPA, Jason. It's actually more of what I would call clinical decision support. It's a workflow with algorithms based approach. So it's natural language processors used. It's algorithms that are built over time to further clarify what's being said and how that is placed into the documentation for the diagnosis. I mean, it's all about getting that diagnosis.
I can promise you that the vendors are going to call it AI. That's
there you go. So there you go. That's the elephant in the room, Jason. It's the AI conversation, and that's why we just a couple examples of the AI that's happening today.
So, but I did want to put a little levity on it, because when we talk about AI and have these conversations, especially with peers maybe outside of the healthcare industry, and you say, hey, AI in healthcare, they think a robot's coming in the room and taking your vitals, right? A la the Jetsons. So we're not quite there yet, right? And that's why you try to put a little context around what it is that we mean when we say AI. So I appreciate you giving a couple of those examples. We'll get to RPA because I think that is a very interesting conversation I would like to have. We can get to that in a couple minutes. But David, I want to get you involved here from your perspective. And I didn't introduce him earlier, but we have David Gulian, the CEO from Futura Healthcare, joining the podcast. David, from your perspective, what emerging technologies is Futura as a company keeping their eyes in? Or on, I should say, investing in, being aware of? Where does that conversation sit from your vantage point?
Sure. So it's very difficult for right now to understand adoption, right? And I've been in situations, Jason and team, that I went too early, right? I played around in telemedicine over 5-6 years ago, and there were a lot of reasons for it not being as, connected to the customers or being a motivator to organizations overall. A lot of that had to do with reimbursement. So again, I'm being very cautious right now. AI is a big word. It's like big data in the past. It means something different to every organization overall. You think about what everyone thought RFID was going to be the big thing, right? All these buzzwords, and it never clicked in and never caught on. So I think there is a spot on what we provide on productivity improvement, workflow, and looking at AI to apply on top of that. I am relying on a lot of third-party advisors to our organization, because when you're not working on the inside of an organization to understand the difficulties, the challenges, the gaps that some of the technology can play, it's always great to have someone around us like a Tom, like a Ken, and other people that can go ahead and tell me what they think is going to be adoptable or where organizations are going to spend money. I do still think that telemedicine, because of the pandemic, we've learned how to do things remote. We've learned how to be effective to a certain degree. I think now that we're seeing technology, bandwidth, and infrastructure to take that demand on. I think some of the reimbursement codes are coming into play, but now it puts organizational stress on IT and clinical staff and organizations to be able to manage patients remotely. So I think telemedicine for us and some AI derivatives to what we provide today is where we're headed with Futura.
You know,
So let me
David,
ask
it's
this question.
interesting.
Go ahead.
Just that the kind of 0 to 100 that most organizations went through related to telemedicine because of the pandemic was remarkable. I know within my own organization when I was there, we were doing itsy bitsy pieces of telemedicine prior to the pandemic, and then rapidly had to stand up a platform, get it in place, and then during the early stages of the pandemic, 70 to 80% of our patient visits, our ambulatory visits, were telemedicine. What we have found over the succeeding years is that there is a significant desire and need to have all sets of tools, but that kind of stasis level for the amount of telemedicine that's happening, at least in the two organizations that I've been in recently, was somewhere in that 17 to 20% of all visits, physician office visits. Some specialties higher, but particularly behavioral health. Other specialties significantly lower. And being able to have the tools that allow it to integrate, be easy for the physician, easy for the staff, and most importantly, easy for the patient, so that all works through, has been a challenge. But I do think that the industry's made huge leaps in that space. The other place that I saw, and Tom, I'm sure can talk about that, is healthcare organizations were come to the office places, right? Everybody came to the office. There was no remote work, and now managing a component of your enterprise staff that is can be remote. You're still going through what every other industry is. How do you do that? How do you manage productivity? How do you ensure what's the right thing to do? Those continue to be ongoing conversations inside of the leadership suites that I've been involved in.
So a very
Tom,
a very human element question here that I keep thinking about. Obviously, through the pandemic, we now understand the importance of a remote workforce, or the ability to be remote. We understand the importance of virtual care. The telemedicine piece, I completely understand. The question, we started this conversation about, the vaunted AI. What is AI? Tom, Pacek, you were mentioning that ambient voice recognition. Is there, and again, I'm just asking from the human element, is there a line? Is there a thought between, okay, where is technology valuable, helpful, and then where is that human element necessary, especially when we're talking about care? How do you guys judge that line of where we can leverage AI, but where that human touch is necessary?
Boy, that's a tough question, Jason. It's a really tough question. AI, I would rather say the telemedicine component of it is really, it becomes almost a people preference. Some people just do not want to deal with that technology. As simple as it is to use and as effective as it can be, people want to see somebody in person. And that could be any age. Doesn't just have to be seniors. I know we relate that to senior, the older community. But millennials, sometimes a millennial just wants to be seen. They want to be seen by somebody. They want rapid service. That's an unusual millennial. And the fact of the matter is people do want to be able to choose their preference of how they get care. I think what's driving, or to answer David's initial question, what's driving telehealth is really hospital at home type components. We're moving more and more stuff to the ambulatory environment, and there's just not. Come on, we're in a crisis. We're trying to find nurses. We're trying to find technicians. We're trying to find clinical people to be able to provide those services. When you start moving them out of the hospital and now you got to have somebody show up at someone's home, that's a one-on-one type of event. When you have a nurse that can go hit room 101, 102, 103, 104 within a short period of time, to go to different houses, that takes a much longer period of time. You have to augment that staff with technology. There has to be a component of virtual care that's provided there. And so I think that's where telehealth will stick around. It'll start to get even more adoption, and it'll be adopted by not just physicians but nurses as well, and other types of home care providers, as well as us, people, patients, and their family members are going to get comfortable with that technology and use that to reach out to care providers to talk about mom's care and how they're doing today, and talk with their physician that way. So I think that's still emerging significantly. I think it'll really dramatically continue to accelerate and be adopted. To David's point, we're not done with that world yet. We haven't conquered it yet. It's coming, and it continues to grow.
I always thought, Tom and Ken, that the area for telemedicine for the biggest return is hospital avoidance, if you can, with chronic disease management, the COPDs, the CHF, the diabetes, that's where there's huge costs in the healthcare system to try to avoid it. And again, getting those the amount of reimbursement in order to afford to sustain that and support that is a tough situation overall. I found that the adoption in playing around with Gold 3 and Gold 4 patients in the past that didn't have smartphones or intelligent devices, they're really loving the aspect of they're using it for multi-purposes, talking to families, taking pictures, all these things that I thought would help with compliance. But I also think in today's world, I don't know the percentages like you do across your organizations that you've worked at, but readmission penalties by we had transition of care people that were just dialing every day, how you doing remotely, that somehow tying that discharge and hospital avoidance or readmission, I think, is a great fit for telemedicine.
And David, you nailed it. I mean, it fits very much where healthcare is going, related to population health and managing health as opposed to providing sick care, and therefore being having first premium dollar, being at risk, and using technologies to be able to understand people's weights and blood pressures and all kinds of things in their home, so that you can have early intervention as stuff goes forward. And we certainly see that. There is a significant investment that is happening in remote patient management, but it's been a slow transition, and it's still transitioning from to population health as we go forward. So we've all been revved up here for about 15 years talking about it, and it's been a slow boat to get there. So
okay, Ken. So you said it's been a slow boat, and it's been a 15-year conversation. And as you say that, I'm seeing everybody's head, they're all nodding in agreement.
Yeah.
What are those hurdles? Why so slow? What's the resistance?
Oh, I think it's the nature of U.S. healthcare. The government-based plans have more rapidly moved to managed care, and commercial insurance has stayed vastly fee for service. And even in the Medicare world, where people have a choice of being in a Medicare Advantage plan, which is managed care, or in the standard Medicare fee for service, in the market I work primarily in southeastern Pennsylvania, 50% of the people stayed on fee for service. Other markets have gone more because of the choice, that people feel they have greater choice in doing that, even though healthcare is probably better driven by having the incentives be about exactly what David talked about, keeping people out of the hospital and keeping people as healthy as possible as they go forward. But the economics in the end, Jason, have been driving this, and people's choice. So
Economics usually do drive things. A
Yeah.
little bit ago, I referenced RPA, and before we get out of here, I do want to talk a little bit about robotic process automation. I find it amusing, I guess, in our own world, in our own daily lives, our personal lives. We welcome, I'm going to say leverage, we welcome technology to make our lives easier personally. But when it comes to businesses, we seem a little more reluctant to do that just yet. We are leveraging administration, people, body, resources to do things such as data entry, invoice processing, reporting, et cetera, et cetera. So when we're talking about emerging technologies, how critical is RPA, and how do you see that affecting the industry?
I personally, this is Tom, and I think robotic process automation is something that every organization should adopt in some capacity. It generally gets used, I've seen it used mostly in the rev cycle areas. So billing, you mentioned it, Jason, billing, repetitive tasks that are done on a either repetitively, hourly, weekly, daily, those types of tasks can get automated and have so to speak, a robot do that for you in the background, doing that processing. The advantages to that, they don't take PTO time. They're never sick. They work 24/7. They're not 8 hours. That's the advantages to it. Now, it does need some maintenance. So when you make a change to that workflow, you got to make sure you update your robot to understand the new change. But that's the component of it. So you build it, you put it in, you test it, you put it into implementation, and then you monitor it. And that's the process. And that's a whole lot more cost effective to do than to have a human being do that work for you. So I think it'll continue to be adopted. I know I talked to my peer CIOs over the last 2 years, and everybody had that in their portfolio or on their roadmap to have for their organization in certain areas where it made sense. Most of the time it wasn't in clinical areas. That does not mean you couldn't do it in the clinical process, but for the most part, it's being done in non-clinical areas.
Hey, Tom, I think about AI, I think about low-hanging fruit in organizations, and knowing my background in technology, I think of IT first for me. And I remember Ken, a while back, you and I looked at outsourcing some of your help desk and call center stuff. And you told me the largest percentage that you had was password resets. And I think, wow, what a low-hanging fruit. Is everyone doing that and handling certain IT aspects to help reduce the uptime or increase the uptime, but reduce the time and spend on diagnosing IT tickets?
David, you're spot on. Tom, you're spot on. The use of RPA and AI within those enterprise services for those really straightforward tasks, not even straightforward, but really easily documentable tasks are critical. And I 100% agree with you, Tom. I don't know any organization that isn't making some investment in that because it's so valuable. And David, the help desk piece is one of them. I think even it will get to the patient access side, the scheduling side. More and more of all of us like to do things online as opposed to pick up the phone. And most times you're going to schedule an appointment at a health in a healthcare world, you're calling somebody, and if you can do that online and there's some smarts behind it, and there's even a chat bot that gets you to the right kind of physician through that would be great, right? I mean, those are the places where I think that we would all see a real step forward, which is probably some combination of, whatever we're calling AI and RPA.
I have a challenge because I try using Open Table all the time, and I can never get the time I want. But I know if I pick up the phone and I call the people that I know at the restaurant, I get in right away. So it backfires in my situation.
Yeah, it's exactly true. So,
But you tried. That's the point. You tried to leverage the technology. From an overall technology perspective, are there any other technologies, without going too far down the rabbit hole, we talked about the low-hanging fruit, but any other ones that are staring us in the face, again, without that rabbit hole, that are worth the discussion?
I'll add one more,
one
more that
I got one
that I
too.
see a lot.
Yeah.
Here we go.
No, just one more that I've seen. I have had personal experience with this type of technology, and I saw some more of it at HIMSS, and that is future diagnosis, being able to predict future diagnosis by looking at the ability to evaluate an image, a radiology image. And although it may not show a lung nodule, it shows enough material information on that image to see that is where it's going, and using that in conjunction with like pathology information, and you can correlate that data to then say, hey, this patient's right on the verge, they're just about to, they will have lung cancer within the next year or so. But to look at the image itself, the radiologist may not be able to say you have lung cancer at this point, but we can, with a very heavy confidence level, say that's the direction you're going. You're destined to have that. Let's start working on it now and get ahead of the game. I saw that in several instances at HIMSS, technology like that coming. Like I said, I've worked with some of that technology. We were able to prove that as well. And I think that's where it's going. We're predictive diagnosis, and to get out ahead of it and to prevent a bad outcome or a disease from actually coming full blown into your system. You can avoid that by getting out ahead of it. And that's where I think that's where you're going to see the true value of AI and these emerging technologies take us.
Tom, that's wild to me, because as you say that, and I saw some of those similar things at HIMSS as well, but as you say that, I'm lying if my brain doesn't start going towards the old movie Minority Report, because you're talking about future state, right? Your predictive healthcare, and it's wild to me that we're in a state where those technologies are starting to, point of the episode, starting to emerge, right? Where that may become a reality. Absolutely wild. And I'd be remiss if I didn't mention that. Ken, you said you had another part.
Yeah, mine's somewhat related to what Tom said, and that's really mining your own data. David talked about data analytics. We're still not utilizing data as well as we can, and assessing inside your own health system with your own data some of those secondary findings and other things that have that you found within your patient population, and then ensuring that the appropriate follow-up has happened, which obviously from a risk perspective, from a patient care perspective, is incredibly important, but also from a revenue generating perspective, by saying, hey, we need to get you in to do another scan of your lungs because there was a small potential nodule we saw 2 years ago, and let's see and make sure that you're getting the right care you can. I think there's some real opportunity in just as opposed to fighting for new market share, utilizing your own, in the crassest terms, selling to your own, and being able to provide those services to your patients.
I appreciate that. I think we've gone a little long on time, but it's well worth it. It's a good topic to go long on. I do want to thank each and every one of you, Tom Pacek, Ken Levitan, David Gulian. Thank you guys for joining us. Thank you for tuning in to today's episode. Now be sure to subscribe, listen to future episodes of the Elephant in Your Hospital podcast, or simply visit our website at www.futureworks.com/podcast.